you know, for every 10,000 nurses, 38 are physically abused in hospitals by other nurses or the actual patients. Today I want to talk about why this is wrong and what we can do to find a solution for this problem. I know a lot of you may not think about nurses in such a violent manner, or even some of the patients, because we are the patients sometimes, and it's hard to think that we would actually be the ones, the patients would actually be the ones causing the violence in the hospitals. I've actually been in the hospital over the summer, and I witnessed a nurse getting attacked by a patient simply because she did not bring him water. It's just something as easy as that, and some of these patients who may be mentally unstable can justify their means for their actions by something simple as not getting their water. First off, I'd like to talk about the different types of people that are doing the abuse to the nurses. First example would be the patients or the inmates in the hospital. They may lash out if they're mentally unstable, as I previously mentioned, or if maybe they're in pain, or they're grumpy, and they can just lash out at the nurses. According to Philly.com, a nurse in California bent over to help a nurse who was actually bent over to help a patient who was faking a seizure, and as soon as she bent over to help him, he smashed a lamp on her head, and she actually died 3 days later. And they're not sure why to this day the patient did this. It actually happened 3 weeks ago. It's just the randomest things can happen from these patients. The second source of the abuse is other nurses. These nurses may fight over tools or supplies. They've had long days, and just a little thing can make them snap sometimes. So now I've discussed where this anger comes from. I'd like to discuss, now that I've discussed who's doing the abuse, I'd like to discuss where this anger is coming from. Some of these nurses could just have long, bad days in the hospital. Everyone has bad days. The patients may be annoying, they may be needy, and the nurses are just stressed out from that. These nurses are also used to using their hands to pretty forcefully to sometimes to help patients CPR, and when they get angry, sometimes they carry over this hands-on idea to other nurses when they instead of trying to voice their opinions or discuss to other nurses, they sometimes use their hand, which causes abuse. Now I've talked about where this stress and anger comes from that causes these fights. I'd like to discuss some solutions we may have. It's very hard to deal with some of these cases because, like I said, it comes out of stress and anger, and you can't really tell when it's coming and when it's going to happen. But what we can do when we're in the hospital, again, hopefully we're not, is to create more stress-free environments for the nurses. Since most of the stress for the nurses are coming from the patients, we need to do our best to be as nice as we can to the nurses because it's their job to take care of us, and that's what they want to do for a living, is help others, so we can at least help them help us. Another things the hospital employers can do is invoke more breaks for these nurses, or maybe longer breaks, just so they can take time to recover from any crazy days or stressful times at the hospital. They could also hire more nurses so they don't have as few nurses doing so much work. They could have a ton of nurses helping each other out, depending on their financial situations, of course, but it would help the overall attitude of all the nurses. As for the patients, again, it's really hard to tell when it's coming from them. You don't know the patient that well except for their medical record, but you don't know kind of like what's going on in their head at that time, depending what kind of accident or why they're in the hospital. But they need to profile if they are mentally unstable or any past actions these patients have had. And if they do have a history of that, the nurses need to keep a close eye on them and be careful when they're handling them. So today, I've talked about who's doing the abuse, where this abuse is coming from, and what we can do to try and help get rid of some of these abuse cases in the hospitals. I do want to leave you with one thing. Like I said, I know a lot of you don't think as the nurses as such violent people. It's their job to help us, but next time you're in a hospital, try and help them